Good evening and welcome to Live at Grange. Live at Grange is our panel discussion coming to you every evening as part of the Teagasc Virtual Beef Week supported by FBD Trust. Each day we are focusing on a different topic, and today our focus is suckler systems. So join me and our panel of experts in the studio for Live at Grange. Good evening and welcome to Live at Grange. Live at Grange is coming to you as part of the Teagasc Virtual Beef Week, sponsored by FBD Trust. Each day as part of the Teagasc Virtual Beef Week, we are covering a different topic. And today our focus is suckling systems. We've had wonderful engagement throughout today on social media and on our earlier broadcast, Beef Talk at midday. This evening, we're staying on that theme of suckling systems. However, we now move to a live and interactive broadcast. It's live coming from the studio here at Grange, and it's interactive, so we encourage you to participate by text on 51444 for viewers in the Republic of Ireland, or on Twitter using the hashtag Virtual Beef Week. This evening, our two focus topics are breeding efficiency and herd health, two critical areas of performance for suckling systems. I'm joined in the studio by our panel of experts, Professor David Kenny from Teagasc Grange, Frank O'Sullivan, veterinary practitioner and who provides services to the research centre here at Grange, and Dr. Orla Keane, research scientist with Teagasc Grange. We're going to start with breeding efficiency. Before I move to David Kenny to discuss all aspects of breeding efficiency, we're first going to play you some footage we recorded last week. We met with Artie Bert, who is a prize-winning suckler farmer in County Down. Artie participated in a research trial led by David Kenny a number of years ago. And we'll hear how Artie got on in the trial and his farm systems. So we'll see Artie now.
My name's Artie Burt. We run a suckler to beef farm here in County Down, just at the tip of the Ards Peninsula. Cows are predominantly Sim limbs and Charlie terminal sire. We take everything through to beef and bucket rear a few calves as well. We're up on cow numbers. We had a very tight calving spring herd of 180-ish and 190 cows, and we had 7 stock bulls. We found that the stock bulls finished up lying about all year. They were only needed a few weeks. We finished up then, although you maybe only needed 4 or 5 bulls, you always had young bulls that needed small groups. You always needed a spare bull because at some stage during the year something got hurt. We found then they were lying about. You had 7 bulls in the house. It was costing too much to keep them. We started looking at another option. Yeah, we were involved with the joint Hillsborough and Teagasc research trial back in 2014. We got conception results of between 60 and 72% to first service. We have been using synchronization since probably back as far as 2012. We have found it is a good tool to keep the calving interval tight. We would have used it on late calvers to pull them forward. The stragglers, you can go in from 30 days and you can tighten them up. But we also found that you were more focused on a breeding season. You had a start date and a finish date, and you didn't have a rogue bull floating about that you needed a home for, and you were inclined to let calving linger on. Typically we would have done fixed time AI. Would have got everything served once. We would then have possibly either done repeat AI, depending on the availability of sweeper bulls, or the sweeper bull could have alternated between 2 batches of cows, and would have probably done that twice. And we were only focused on repeat AI with a batch of cows. You would only been focused for 2 5-day windows whenever they were due to repeat and repeat again. You weren't all the time, continuously watching cows. The most number of cows we ever synchronized on one particular day was 81, and there's a natural spread anyway in cows, from the cow that calves 10 days early to the one that will run over 14 days or so late. We would have 12 calving pens to 180 cows. It wasn't a huge issue calving that many cows. Would use to our advantage, would typically use the gestation length of the bull to your advantage. You could use a shorter gestation limousine, hope to get them calved before the longer gestation Charlies maybe come in. Another advantage that I see in doing this, you're able to negotiate prices because you're doing so many. You can phone the vet and you can ask them their price and you can negotiate it, or you can negotiate your AI technician what he's going to cost. You bulk buy your semen, you can get the semen of genetically better bulls. You can use the figures figures will have accuracy as opposed to the stock bull. No matter how good your stock bull is, your figures will not be nearly as accurate as what you'll get out of an AI catalogue.
Some really interesting points there by Artie. I'll now turn to Professor David Kenny of Teagasc Grange, who led the project that Artie referred to. David, you led this project on synchronisation and the use of AI in the suckler herd. Can you tell us and tell the farmers watching here this evening, what were the main findings from that research project?
Yes, Paul. Artie was one of 80 farmers that participated in the Department of Agriculture, Food and the Marine sponsored 2-year project for us. And essentially we were comparing 3 different synchronization timed AI programs on farm. Cows were subjected at about 35 days after calving to the program, and they received 1 timed insemination. Follow-up breedings then were either natural service sires that the farmers may have on the farms, or some farmers elected to breed the repeat cows by AI. And I suppose overall we found very acceptable conception rates of somewhere between 50 and 70%, averaging at about 55%, which is quite significant when you consider that half of those cows at the start of the breeding season hadn't resumed normal cyclicity. So essentially we're inducing heat, we'll say, in a large proportion of those cows. Overall, when we combined, I suppose, the timed AI with the subsequent breeding of those cows 3 weeks later, we found that 80% of those cows were pregnant in the first 3 weeks of the breeding season. So obviously that has, significant, I suppose, positive ramifications for not alone the duration of the breeding season, but also in terms of shortening, we'll say, or condensing the following calving season. And as a consequence, then again, there will be knock-on effects for the following year, in that the cows, that overall herd will be tightened up in terms of breeding and calving.
Okay, and Artie mentioned that he used to have a number of stock bulls on the farm. That was his traditional breeding system. He's now moved to a greater use of AI. Apart from the I suppose the labour performance that he found with using more AI, what other benefits would you see through the farmers and in general from the use of AI in the suckler herd?
Well, obviously, as Artie alluded to there, there's significant advantages in terms of, I suppose, just the information that you have on those bulls that you're using. You can choose bulls with a much greater degree of certainty for the traits that you're interested in, whether that be in terms of breeding high-value maternal replacements, or indeed bulls to produce terminal progeny. Equally, when it comes to calving, difficulty or calving ease, you can select bulls for either your heifers or for maybe your second calvers with, a fairly, I suppose, strong confidence that those bulls will say have a propensity to produce smaller calves at birth. So obviously that, and most farmers would acknowledge that on average, we'll say calves from AI sires are better quality and produce better quality calves, we'll say, than your run-of-the-mill average stock bull.
So substantial benefits from the use of AI. I suppose in terms of the trial and in general, were they predominantly mature cows, or were there heifers involved? And would you have a different protocol for heifers when compared to mature cows?
Yes, in that, by the design of that study, Paul, they were all at least first calvers. We had no heifer, Absolutely, you can use timed AI protocols for heifers, but I suppose our advice would be to try to grow heifers, in a way that they're a high proportion of them are cycling or have gone through puberty at the start of the breeding season, and then if that's the case, a much cheaper, we'll say, and straightforward, maybe prostaglandin-based protocol would suffice. And for viewers and for farmers that are interested in, we have a lot of information and a lot of detail on the Teagasc website in terms of the different options that are available both for heifers and for cows.
Absolutely, and we'd recommend our viewers to view the Teagasc website for more information in relation to all of these protocols.
Absolutely.
I suppose, one of the questions that often arises is, are we inadvertently, if you like, breeding for poor fertility by using these, interventions, synchronization protocols? So, the cows would obviously more than likely have been culled at the end of the breeding season. So, are we inadvertently breeding for poor fertility?
I don't think so, Paul. And again, this is something, anecdotally that might be mentioned from time to time. But I would argue that it's the opposite. Essentially, you cannot make an infertile cow fertile by using these type of interventions. It's really just a tool to, I suppose, synchronize breeding. Whether it be that you want to optimize, we'd say, the use of AI for maternal replacements, or indeed maybe just shorten up or tighten up, we'll say, your calving interval. I would argue that it's the exact opposite, in that this allows us to increase the amount of use and usage of AI to breed better and more fertile females. Like if we look at ICBF-based statistics, only about 1 in 6 of every calves born to beef cows in Ireland are bred through AI. With over 85% bred through natural service, and that doesn't bode well maybe for the use of the superior genetics that we pride ourselves in Ireland, would say, in terms of producing.
Yeah, very, I suppose, disappointing figures, 1 in 6 being bred by AI. I suppose if I could turn to you, Frank O'Sullivan, as a vet in practice, have you seen an increase in the use of synchronization regimes and protocols and in general the use of AI? And where have you seen, from a farmer's perspective and the farmers you're working with, where have you seen the main benefits of adopting these type of protocols?
Yeah, well, in addition to the points that David made, many of the suckler farmers that we deal with are part-time, and they actually like the fixed time and synchronization protocols because it allows them to manage their time better. It takes away the multiple maybe time slots spent with heat detection, and not only does it allow the synchronization and AI be fixed, but also down the road it allows the groups of calves to be managed together, maybe the calving time to be focused on. So if you like, suitable use of resources at those times. So in addition, the suckler cow is different to the dairy cow. She doesn't express heat well when she's suckling, and fixed time AI in particular takes that out of the equation, if you like. Now, many of our farmers, like David said, also like the concept they can choose the bull with AI to match that cow. Plus, there's a higher reliability. They're more, if you like, using AI, they're more confident of the end product in terms of what calf is coming out.
I suppose if I turn back to you, David, we mentioned that 1 in 6 approximately using AI, so the vast majority of breeding being done with natural service with stock bulls still. I suppose in the longer and indeed in the medium term, we want to see more use of AI, but for the here and now, we have a lot of stock bull usage, and we're coming near the end of the breeding season. So what should farmers be watching for, I suppose, as we approach the end of the breeding season for spring calving herds? And indeed, at the end of that season, how should they manage those stock bulls at the end of the season and in preparation, I suppose, for later in the year?
Well, absolutely, Paul. I think that, unusually high repeats, obviously we'll say vigilance is absolutely key when it comes to, not alone, heat detection for AI, but absolutely when it comes to natural service, that we can never presume that a bull is fertile, or indeed, we'll say, mating cows properly, and that, particularly is of relevance to young bulls. So, I suppose our advice would always be, whether it be, an older bull that has been used, we'll say, before, or indeed, we'll say, a young bull, never assume that they're fertile, and we know that while absolute infertility might be quite rare, subfertility can have a prevalence of, about 20 to 25%, and that can actually cause a lot more damage in terms of, we'll say, her pregnancy rates than infertility on its own. So essentially, you know, we would always advise, would say that farmers should follow up, would say that particularly the first cohort of cows that have been mated, make sure particularly a young bull is physically able to mate the cows, and you know, get their vet to scan cows in earlier 30 days approximately after mating to ensure that, you know, that normal pregnancy rates are being achieved. When it comes to, I suppose, the end of the season, obviously the bull, you know, needs to be maintained, you know, in good condition, and has to receive the same, you know, veterinary and health inputs as the cow herd, you know, and obviously accommodation needs to be suitable as well, because we know from statistics from the Irish Cattle Breeding Federation that actually up to almost 50% of bulls are culled, not for infertility or not even for poor calf progeny, but in terms of actually locomotive and hurt and injuries that they might receive. So, you know, I suppose again, vigilance with care of the animals is crucial.
Thank you very much, David. So we've seen there in terms of breeding efficiency the importance of herd health, and clearly it underpins an efficient breeding system. We're going to focus in a lot more detail now on herd health, and I'm going to turn to Frank O'Sullivan for a discussion around the aspects of herd health planning. Before I do, I caught up with Frank last week during one of his visits to Grange, and Frank outlined to us, you know, what are the principles underpinning good herd health planning as part of the Grange system.
So my name is Frank O'Sullivan. I'm a veterinary practitioner providing veterinary services to Teagasc Grange. Our role here, be it with the Derry Patrick Suckler herd or indeed with the rearing Frisian calves for beef, is really to avoid disease. Now that disease of course could be clinical or subclinical, and prevention is the key. Herd health planning is an ongoing process that helps us capture at key times of the year what the key diseases are and put in place the steps to prevent that. But that could involve looking at things like ventilation, maybe having the nutrition at an optimal level, and then we can use vaccinations as a support to boost the immunity. We're very aware of the biosecurity aspect in terms of bringing in animals from outside can disturb that biosecurity. And really what this means is that at different times of the year we would, say in the spring, have a meeting prior to calving so we can say, well, how can we prevent calf scours from happening this year? Or how do we reduce the incidence of pneumonia in our calves? By taking this preventative approach and with herd health planning involving all the team, the advisors, the operatives on the ground, we really have found over the last few years that antibiotic usage has gone way, way down. And of course the consumer and the public really like this approach.
So a really interesting introduction to herd health planning there by Frank O'Sullivan. Frank, as I said, is the veterinary practitioner who provides services to us here at Teagasc Grange. He is also on a number of committees with Animal Health Ireland. And I'll turn to Frank now to discuss in a little bit more detail the practical aspects of herd health planning. So Frank, I suppose herd health planning, what exactly does that mean in practice when you're on farms?
Well, herd health planning, the main outcome of it is to save the farmer money and make more profit for the farm. So typically what's involved is that the farmer, the vet and the Teagasc advisor would come together at key times of the year and plan for the season ahead. So to give an example perhaps to make the point, I recall one 40 cow suckler farmer who through the years had terrible problems with calf diarrhea, cryptosporidia in fact, and in the last couple of seasons we came together in January. We looked at his dry cows and said, look, what can we do to prevent this disease happening through the coming season? So the farmer came up with many of the solutions himself, and he got the body condition score correct. That was a key point. He had the mineral inputs into the cows correctly. And then he elected to use a calf scour vaccine to help with the transfer of immunity to the young calf when he was born. So in that process then, everybody would contribute. So it's not a top-down approach, if you like, it's a collaborative or a joint effort to come up with these key solutions. Through the season we went then and said, look, how can we improve the hygiene in the calving areas? Where can we allow, if you like, the ventilation improve and better aeration of the shed? So all these points then, with this collaborative approach, help you come up with a plan. And we map that out, write it down, and share it with the farmer so that he then has a clear plan, if you like, how he's going to manage the next couple of months. So in essence, that means that he has more time in prevention of disease and less time spent treating disease. Lastly, I'll say that apart from the economic benefit, there's a tremendous saving in preventing subclinical disease. That is, disease that maybe is not overtly there, but certainly can cause problems with production. But thinking about that farmer and farmers in general, they really don't like dealing with disease or sick animals. Yeah. So there's a tremendous stress involved in that. And they would really, particular part-time farmers, they love that concept of how can I plan this out so I can go to work in comfort perhaps and come home to enjoy a healthy herd rather than coming home to sick animals.
Okay, so you've seen a significant reduction, let's say, in clinical call-outs, if you want to call it that, where herd health planning has become part of the management process on the farm.
Yes, that is certainly the case. And not only that, the clinical call-outs, you probably end up using quite a bit of antibiotics and so on to very sick animals, and the treatment outcomes can often be poor. So, if you like, the time is much better spent focusing back upstream and preventing these. So, if you like, herd health planning is a key word here now, because planning shows that there's a dynamic going on. It's not just a plan sitting on the wall for the year. There's a dynamic going through it as well. And, you know, part of that too is you might have to put in certain monitors to see how is it going. So Orla will mention parasites, and we'll see how the fecal sampling is a monitor to tell you how you're managing things. For that calf, farmer with the calf diarrhea, we used, and do in Derry Patrick herd as well, we took blood samples from the calves less than a week and looked at their transfer of colostrum. We were able to look at their IG levels and say, yes, they've got enough colostrum, we're doing a good job there. So planning, if you like, it helps to reinforce to the farmer that you're doing a good job here. And it's no harm when that news is shared. It's almost a celebration in that way. So, but the monitors are key, and farmers are very good at, if you like, looking at their animals, and then they become deft at assessing their wellness, if you like, as well.
And has that changed the relationship between the farmer and the veterinary practitioner? So we've moved from, if you like, a reactive approach where health incidences occur on the farm to a much more proactive approach, it would seem.
Yes, I would agree with that point. So that our role has changed to one where we share information, and so the farmer is a co-developer, a co-author, if you like, of the herd health plan. And that means that, you know, if you design something, you're going to take ownership of it. If someone shoves a plan at you or forces it at you, you're less likely to take it up. There's another bit to this now. The farmer knows his animals, he knows his farm, he knows what works, he knows what he can manage to do and what not. So we would try and work within those constraints, if you like. And if a farmer has certain help at weekends or certain facilities, we work within that. And that means that the plan is bespoke to him. It's individual to them, and they can adopt those principles, you know, and look forward to doing that. So we find, you know, for me it has revolutionized how I work. Communicating very openly with farmers, and if you like, often working more as a facilitator than top-down telling you these are the 4 things you must do. That doesn't work. We know that.
Yeah. And when we view, I suppose, the policy measures and proposals that are coming through, particularly with respect to antimicrobial usage, presumably herd health planning now will become a much greater part of that relationship between practitioners and farmers.
Yes, I mean, and we even see this in the Derry Patrick herd, where we would have these regular meetings, maybe one in the springtime in January with Michael McManus earlier today and all the researchers. Maybe again, pre-housing is another key time for a herd health meeting. What we found is that, yes, the use of vaccines has increased. And similarly, there's been a significant reduction in the antibiotics we use on the farms where the herd health planning is in place. So really the consumer just loves that. And it's going to be more and more important, as I would suggest, as time goes on.
You've also mentioned as part of the footage the importance of biosecurity. Do you want to maybe just develop that a little bit? How important and where do you see that coming as part of a herd health plan?
Well, indeed, David mentioned, the use of the bulls and whatnot. They can be, even for a closed suckler herd that's buying in a bull, that can often be the animal that breaches the biosecurity boundary, if you like. Look, I think it's a fair statement to say for practices across the country, herds that are closed and have a secure, biosecure boundaries and don't buy in animals routinely, they have much less trouble with disease and probably better performance than herds who are very open and buying in a lot of the time. So biosecurity is such an important concept. I recall my father used to delight in coming home from Kilkenny Mart. He'd have different animals home every weekend, and he'd upset the whole herd for the weeks after. So really, the concept of biosecurity goes alongside maybe a vaccination policy. Now, biosecurity isn't just the fact of buying in animals. So being biosecure also means you have to think about the people and the fomites. So, maybe we shouldn't be sharing trailers, maybe we shouldn't be sharing handling facilities. And I know as a vet, and AI technicians are the same, that we're very conscious to disinfect in and out as we go to farms. Animal Health Ireland are very strong on this too, and we see the benefits of the BVD scheme and the lack of introduction of PIs from one farm to another. So, biosecurity is a big part of it.
You mentioned the importance of covering the whole area of parasite burden and parasitic infection. And I might turn to Dr. Orla Keane now just in relation to that. And I suppose it's an area where you've devoted a lot of your time, a lot of your research, Orla. And just in terms of the Derry Patrick herd, do you want to maybe relate a little bit of the parasite control plan that's in place there on the Derry Patrick herd?
Yeah, so I suppose on the Derry Patrick herd here in Grange, the two major parasites, and particularly at this time of year that we're concerned about, are lungworm and gutworms. Now, the way the weather went this year, we had a very dry spring. So when you get prolonged periods of dry weather like that, the worm burden tends to stay low. So the larval stage of these parasites, they migrate, they move in water. So when you get a dry period, they can't migrate out of the dung or up the grass to be eaten. So the worm burden tends to stay low. Then after you get some rain, you'll probably see the larval burden will go up about 2 weeks afterwards. You won't see it in the fecal samples that Frank mentioned earlier till probably at least 3-4 weeks later. So what we found this year in the Derry Patrick was that in terms of the gutworm count, that has been low and that has stayed low so far. And that's probably because, in suckler beef systems, it's really only when you get close to weaning and their grass intake increases substantially that gutworms tend to be a problem. Lungworm can be a lot more unpredictable. And, about 3 weeks ago now, we did go in and treat for lungworm based on clinical signs.
Okay, and I suppose back to you, Frank, just in terms of the overall herd health planning process, we've seen some wonderful figures from Bernadette early this morning, and in particular from Michael McManus in terms of the performance of the Derry Patrick herd with 100% AI, calving in a 10-week breeding season, really fabulous performance, underpinned by a strong focus on herd health planning. One of the figures, though, that Bernie did produce that maybe surprised me a little bit was that as part of a research programme that she carried out recently, 60% of antibiotic usage occurred in the first month of life. So this would seem to be a critical period where a lot of intervention occurs, a lot of antibiotic usage occurs. As part of a herd health planning process, where would you see as the key factors to maybe minimise that period and minimise the amount of antibiotic usage during that period?
Yeah, so if you get things right in the first month or 2 months of life, the health of the animal and the production really flows very well. So we'd see two major challenges. One would be enteric disease in the newborn calf. I've mentioned that earlier. So part of our work there is to look at the particular herd, look what issues they have, know what's happening on the ground, be it cryptosporidia, rotavirus, E. coli, and put prevention strategies for that. Now, probably more subtle but very, very significant then is the respiratory disease. And that can often be insidious in onset. It can be subtle enough in calves. So we look very strongly at the bedding, the cleanliness, the ventilation is key. And then in the Dairy Patrick herd and in many other herds, we use vaccination programs, both intranasal and injection, to prevent or help support the immunity against key diseases such as RSV, PI3, Pasteurella, and even IBR later on. So, you know, we're aware these bugs are around, but, you know, I recall the UCD herd health team advising us on one occasion. They came to visit Grange saying, will you stop hunting bugs and try and just get, you know, we know that these viruses are circulating there, just let the environment, the immunity, the if you like, the nutrition, supported by vaccination, not relying solely on vaccination. Let them work together, and then you will see how, you know, you have much less disease footprint in the herds.
Thank you. So a multifaceted approach.
Yeah.
So thank you, Frank. We've seen the importance of herd health planning, and we've touched a little bit on parasitic infection and the importance of control around parasitic infection. We're going to deal with that in a little bit more detail with Dr. Orla Keane from Teagasc Grange. But before I turn to Orla, I caught up with Orla in her lab last week to discuss some of the programme around parasite control strategies on suckler farms.
So I'm Orla Keane and I'm a researcher in Teagasc Grange. Irish cattle production aims to maximise the contribution of grazed grass to lifetime feed intake of the animal. But of course, one of the consequences of grazing is exposure to gastrointestinal parasites or gutworms. So there are a number of different gutworm species that can infect cattle, but they all have a similar life cycle. So adult female worms in the gut, they lay eggs, and those eggs pass out with the dung onto the grass. The eggs hatch into larvae, and the larvae then move out of the dung onto the grass, where they are eaten by grazing animals. The larvae then go to their site of infection in the gut, where they mature into adults that lay eggs, thus completing the life cycle. So when calves are born, they're fully susceptible to gutworms. However, suckler calves, because grazed grass isn't the major contributor to their diet early in their life, generally gutworms are not a big problem in suckler calves in the early and mid-season, and it's usually closer to weaning, when they have a much greater grass intake, that gutworms can become a problem. So in most years, suckler calves only require minimal treatment. Yearlings, if they don't fully develop immunity in their first year, yearlings may require treatment for gutworms. Now, there are a number of different products available to treat gutworms, but they all belong to one of three classes. So these are the benzimidazoles, or the white doses, levamisole, or the yellow doses, and the macrocyclic lactone, or the clear doses. So it's important to note that once resistance develops to one product in a class, then all of the products in the same class are generally affected. And this is because all of the products in the same class have a similar mode of action. So if you have resistance to one white drench, you generally have resistance to all of the white drenches. So we know now that resistance has arisen on a number of cattle farms in Ireland, and that this is an issue that farmers need to will need to deal with in the future. It's important that we reduce our reliance on anthelmintics, and one of the ways that we can do this is to reduce the exposure of naive animals to worms. So there are a few different ways of doing this. One way is to creep graze calves ahead of the cows. As the cows come along behind them, they will clean up the pasture after them. If you have cattle and sheep, then mixed grazing of cattle and sheep can also reduce exposure. And this is because the worms that infect cattle are not the same species that infect sheep, and vice versa. So one of the risks for the development of anthelmintic resistance is underdosing. So it's really important that when treating an animal with an anthelmintic that they're given the correct amount of product. So in order to do this, it's best, if possible, to weigh the animals or weigh a few of the largest animals in order to calculate the dose rate and to dose to the rate of the heaviest animals. It's also important to calibrate the dosing equipment to ensure that the correct amount is being given. Another risk factor for the development of resistance is the number of times that we treat. So it's important to try and reduce the number of treatments that we give. One way to do this is to make sure that we only give a treatment when we know that it is needed by using reliable indicators like performance average daily gain or the level of parasites as determined by the fecal egg count. Fecal egg counts can also be used to determine what products are effective at killing the gutworms. Recent research from Grange has shown that anthelmintic resistance has now been detected on cattle farms in Ireland. Therefore, it's very important that farmers are aware of this and that they implement sustainable strategies now so that resistance doesn't develop further and that we maintain the efficacy of the products that we have available to us.
So some really interesting points there from Dr. Orla Keane. Orla, if I turn to you, in the video you mentioned the development of anthelmintic resistance and that now it's been detected on cattle farms. Can you tell the listeners, what do we mean by anthelmintic resistance?
Okay, so I suppose there's been a lot of talk recently, and you would have heard this morning, and as Frank mentioned earlier, there's been a lot of talk lately around antimicrobial resistance, where bacteria develop resistance to the products that we use to treat them. But similarly, worms, parasitic worms, can also develop resistance to the products that we use to treat them. So anthelmintic resistance refers to worms that can survive a dose or a treatment with an anthelmintic with a wormer that normally kills them. So this has been known for quite some time that there's been anthelmintic resistance on sheep farms in Ireland, but it was believed to be more rare on cattle farms. However, some of the recent research that we've carried out here at Grange has shown that anthelmintic resistance is more common on cattle farms than we previously thought, and that the level of resistance to the different classes of anthelmintics, the three classes that were mentioned there earlier, the white wormers, the yellow wormers and the clear wormers, that the level of resistance to these products is different, and of course it will be a property of the farm. So again, very much coming back to the point that Frank made earlier about how parasite control plans really need to be tailored for the farm in question.
Okay, and is it an issue for gutworms or is it lungworms, or is it both, or where do you see a greater issue there?
Yeah, so all of the work that we've done to date has looked at resistance in gutworm populations. So as I mentioned, we found quite high, surprisingly high levels of resistance in the gutworms. In terms of lungworm, there's been very few studies that have looked at resistance in lungworm, and there's a few reasons for that. It's very, very difficult to carry out the test for lungworm, and quite often when lungworm causes disease, it's in the pre-patent period, so this is before any of the larvae are shed in the dung. Anecdotally, there have been some stories of failure of the products for the treatment of lungworm, but it would appear that any resistance that's out there for lungworm is much more rare, and that most of the cases of resistance that we're seeing are in the gutworms. Okay,
and based on your research carried out at Teagasc Grange, have we been able to identify the risk factors on certain farms? So what let's say, encourages, if you like, the development of anthelmintic resistance on farms?
Yeah, so there's a number of factors that we know can accelerate the development of anthelmintic resistance. So I suppose one of the factors that we know is the current resistance status. So if we, anthelmintic, the development of resistance is effectively like a slippery slope. It goes slowly at the start, but then it accelerates. So obviously if you don't have resistance or very low levels of resistance, that's the time to implement the strategies to slow it it down. Another factor that we know is important is how many times you treat. So the more you use the product, every time you use the product, you give the resistant worms a selective advantage over the susceptible worms. So treating unnecessarily and when it's not required, that's a huge risk factor for the development of resistance. A third factor is underdosing. So if you expose the worms to not enough of the drug to kill them, that will also lead to the development of resistance. And then the fourth factor is a factor, it's quite a complex factor, but it's the refugia factor. So what refugia means is it's the proportion of worms in the population that are not exposed to the drug. So these are generally in worms on pasture or worms in animals that aren't treated. So these worms are under no selective pressure to develop resistance. They provide susceptible genes that will breed with the resistant worms and dilute the effect of resistance. And of course, in suckler systems, a great source of refugia can be the mature cows.
Okay, so that's interesting. So part of our objective then, as part of a dosing program, is to maintain a population of worms in the pasture.
Yeah, absolutely. So I suppose, you know, as resistance develops to these products, as we outlined there, despite the large number of products on the market, there's really only 3 classes. So it's very important that we preserve the efficacy of the 3 classes that we have. And so, you know, the solution now is much more about planning and including a parasite control plan as part of your herd health plan that will allow you to reduce the amount of wormer that you use. And it is about, you want some worms, you need exposure of the calves to some worms in order for them to develop their immunity. So it's about managing that exposure so that their immunity develops, but they do not suffer production loss or clinical disease.
Okay, and Frank O'Sullivan, as a veterinary practitioner, have you seen this rearing its head on farms? Have you seen anthelmintic resistance, you know, appearing on farms, and how is it manifesting itself?
Well, certainly we've been familiar with the sheep farmers for a number of years that this has been a big issue. And it's becoming more and more common now on cattle farms, both beef and dairy cross animals being reared. So, well, the best way I can describe this is to give you an example of a case I saw at the weekend where we had a farmer, his suckler calves were just starting to cough. We had taken a fecal sample from them a week ago, and the worm count was extremely low. So now we're in a bit of a dilemma, because is this cough as a result of, if you like, immature lungworm that are migrating through the lungs, causing a reaction, causing an issue, but haven't yet matured in the airways, if you like, and therefore no eggs have been laid by adult lungworm. So the point here is, of course, that the fecal egg test doesn't forewarn us about the possibility of lungworm. So that's why the farmer would be key here to be herding his animals and listening for that. If they were previously healthy and now we are in a coughing situation and no other obvious reason, we would suspect lungworm and we would feel, you know, warranted in moving in to treat those animals. Now, there are some tests we can do. We can do some tracheal washes for lungworm and find those evidence of the lungworm there, or even, you know, fecal samples after a while. But for us in practice, the key one is the differential diagnosis. Is this the tail end of a respiratory viral syndrome, or is it a lungworm issue that's emerging? And they're the balances we make. And, you know, to come to a conclusion in those, we often, with the farmer, examine the animals, take our time to think about them, and then use some confirmatory tests, and then plan the way ahead.
I suppose, Orla, you know, for many of the farmers watching in this evening, and Frank has alluded to, you know, the differential diagnosis and trying to identify, you know, the correct treatment. I suppose what farmers want to know is what product to use, you know, how much of that product to use, and I suppose it's following the guidance that's provided. So what is the advice around that? So, you know, previous advice would have been to rotate products that you use, and that is still good advice where you know that all the products are effective. But what's really important is to use a product that works. So
that really involves, coming back to the point Frank made earlier about testing. It's really, really important to test so you know what products work on your farm and then rotate among the products that work. But if any of the products are failing or are failing quite significantly, they may need to be dropped out of the rotation because they're no longer doing the job, they're no longer killing the worms, and it's leaving the animals still exposed to those worms, and it will probably encourage the development of further resistance. So in terms of the product to use, you know, we get asked this question a lot: when will I dose and what will I dose with? And of course, you dose with something that works, and the only way you'll know what works is by testing.
Okay, so it was previously advised to rotate wormers.
Yes.
Is that still the case, or are we saying now to, if it's working, to maintain the same dose?
Rotate within the products that are working, within the classes that are working. As I mentioned, there's 3 classes. There's a large number of products on the market, but they fall into one of these 3 classes: the white, the yellow, and the clear wormers. So rotate the classes that still work on your farm. So of course, if that's all of them, then rotate among all of them.
Okay. And just in relation again to previous advice, dose and move, is that still the advice, or what are we saying around that?
Yeah, so I suppose the advice in terms of dosing is not to dose and move to clean pasture, because this comes back to this point I made earlier about refugia. So if you treat all of the animals in a herd, and then you move them to clean pasture, so you know, after grass or something like that, where there's very few worms on the pasture, then you very little refugia. Most of the worms have been exposed to the drug, and any that have survived will be resistant, and they will shed eggs out onto that pasture. So in terms of dose and move, we would say don't dose and move to clean pasture. I mean, if you're rotational grazing and you're not moving to clean pasture, that's a different story.
So rotate within the grazing rotation that you already have established for that group of animals.
Yeah.
And how long would you think before you move to a clean pasture? How long after dosing do you retain on that grazing rotation?
Yeah. So for products that have no persistent activity, you know, up to a week should be fine, because it will allow them to pick up some more worms, some susceptible worms from the pasture that haven't been exposed to the drug before they go on to the clean pasture. Obviously, if you're using product with a persistent activity, then that will be different, and it will depend on the period of persistence.
Okay, you've touched on products with persistent activity. Can you tell those joining us here this evening a little bit more about those products, and are there any specific considerations we need to bear in mind in respect of those products?
Yeah, so I suppose there's a number of products that have persistent activity, and some of them can have quite long persistent activity, and they can be quite popular because, you know, people feel that now they have their worm burdens under control and they don't need to worry about it for a long period of time. The one thing I would say, I suppose, about these products is that they should be used carefully, because again, it comes back to this refugia story. If you treat with a product with a long period of persistency, any incoming worms for that period of persistency will continue to be killed by the wormer. So any resistant worms have that whole period of persistency in which they can reproduce and contaminate the pasture with resistant eggs, while the susceptible worms continue to be killed. So if resistance starts to develop, using a product with a long period of persistency will accelerate that development.
Okay.
Also, as the product tails off in the system, you know, you can have an effect similar to underdosing, because they're long period of persistency and then they tail off at the end. You can have, you know, subtherapeutic amounts of the drug towards the end.
Okay, so I guess it's again about, you know, communication with your veterinary practitioner and watching your herd health planning process.
Yeah, so it's about planning this process.
Frank, you wanted to come in?
Yeah, just picking up on Orla's point. So what has changed, you know, taking the advice from James O'Shaughnessy and Orla's research in Teagasc, is that if we're sampling now, we do certainly a sampling during the season, but we also do a key fecal sampling maybe 10 days, 2 weeks after dosing to see have the worms been removed from the animals. That gives us the confidence that there's still an activity there that's required.
Okay, and we've seen, of course, as part of the social media videos that went out today, the whole process for fecal egg counts and for sending in those samples. Of course, they're part of BEEP, but they're also part of good practice on farms. So we would encourage, I suppose, fecal egg count and using that as an additional tool in our strategy to control parasite burden on farms. I suppose, Orla, you mentioned earlier, just in respect of the Derry Patrick herd, you know, the long dry spell and how that influences, I suppose, the parasite control plan we have had. Just in terms of samples coming in from, if you like, commercial farms, what have we seen this year, and how has the weather patterns affected the type of parasite burdens we've seen?
Yeah, so we did tend to see over the spring parasite burdens stayed low as long as the weather was dry. The parasite burdens stay low. Now they do tend to be much lower in suckler systems anyway than, let's say, in calf to beef systems. They do tend to stay low. So they do stay low. You do tend to see a jump about probably within the egg count. You'll probably see it 3 to 4 weeks after a significant period of rain.
Okay, thank you, Orla. Really fascinating discussion around parasite burden and the parasite control plan on farms. Now we have a huge number of questions coming in. Keep them coming in, 51444 or hashtag Virtual Beef Week. And I'm just going to address a few of these to our panel of experts. I'm going to batch a few together here, and a number of farmers, I suppose, Frank and Orla in particular, I suppose I'm directing this at. A number of farmers here querying, calves, groups of calves that are showing signs of coughing, calves in some cases that have been dosed maybe a week or 10 days ago, some haven't. What is and these are on suckler farms. When you hear that, Frank, coming in as a veterinary practitioner on a call, what's the first thing you think of? Or I suppose, Orla, in terms of the type of samples, what sort of analysis would we think of looking at here? I'll go to you first, Frank, maybe.
Yeah, well, really you need some laboratory help here to make that differential diagnosis. That's not removing the importance of the clinical exam. For instance, if animals are running at temperatures and they've got, certain noise in the lungs, you'd suspect an infectious process going on. You mightn't have that with the lungworm. In addition then, we may have to take some blood samples and look at serology, or take some tracheal or bronchial washes and look at if you like, the cells there, and they'll inform us whether they're eosinophils or whether they're, bacterial infection or whatever. Unfortunately, sometimes we waste the opportunity of post-mortem. Animals die, and it's great to get an early post-mortem, and it often can prevent further losses down the road. So that'll be my key point there. Get a good differential diagnosis, get to the bottom of the problem, and it'll give you confidence going on as to what way to treat.
Okay, and Orla, in terms of the year we've had, if you received a query such as that, where would you start and what would you suspect, I suppose? Yeah,
so I suppose as Frank mentioned, there's a number of different options. Obviously, one of the ones we'd be most concerned about in the parasitology lab is, of course, lungworm. And we do perform Behrman tests for lungworm. I suppose the one thing you have to be aware of with the diagnostic tests in the laboratory, that you are looking at adult worms. In order to see a positive test on a fecal sample, that means the presence of adult worms that are laying eggs, and then the larvae are passing out in the dung, the lungworm larvae. So it may be a negative test is not definitive that no lungworm is present. It is possibly this pre-patent period before they're laying the eggs. It's the larval stage of the parasite, and that can still do damage. So as Frank said, it's part of a much bigger picture.
Okay. So again, communication and engagement with the veterinary practitioner.
Yeah, absolutely.
Yeah. And just to pick up on that then, we have the option now with lungworm perhaps to use a lungworm vaccine.
Yes.
So that has re-emerged. It traditionally was one that was used in the past, and now it's available again. There's certain terms and conditions to using it, but if it's a problem in your farm persistently, it's one that you could look at.
Okay, thank you, Frank. A number of questions here for you, David, in relation to the synchronization program and the discussion that we had earlier on. A number of people querying about subsequent fertility of cows. The cows that have been subjected to these protocols, is there any effect or any consequential impacts on subsequent breeding and fertility?
Yes, that's an assertion, Paul, that comes up from time to time, maybe at discussion groups and other meetings. And I think we've ample evidence now, both within our own, I suppose, observations and also worldwide, to show that there's absolutely no, I suppose, effect or latent or follow-on effect of these interventions, which are essentially all you're doing, we'll say, is briefly interrupting the cow's normal cycle. Using drugs or veterinary medicines, would say, that are very, very similar to the cow's own hormones. Yeah. So essentially, there are studies that we can cite from South America where there's 10 years data with tens of thousands of cows that have been synchronized and heifers that have been synchronized year on year, and looking at the conception rates in those herds, very, very acceptable at 60 to 65%.
Okay, so no concerns for subsequent fertility
on
that basis. Another one here, just in relation to synchronization programs and protocols. cost versus benefit. So there obviously these are, there's additional handling costs and material costs here versus the benefit. Have you looked at that, or where are the figures on that?
Yeah, we've looked at them. I suppose we've looked at, we'll say, traditional AI versus, we'll say, synchronized or timed AI versus natural service. And when you take, I suppose, the various costs and all, so obviously we'll say you have the drug costs, we'll say, and involved in, and facilities obviously as well, we'll say, in terms of the AI usage. And then in terms of the natural service sire, you have the purchase cost, we'll say, and again, it's probably the most singly expensive animal on the herd. But not alone that, but the maintenance of that animal subsequently. And in most cases, in Irish herds, quite small, and many that are less than 20 cows, the actual cost per calf produced over 3 to 4 years for that bull, is quite high.
Yeah.
So when you take the balance, across the board in synchronization or timed AI versus natural service, it's very, very similar, in terms of the overall cost per calf produced. But the actual value of those calves from the AI are much, much greater. And again, data from the States and elsewhere would support that.
Of course, and we've seen Artie Bert, Niall O'Mara and the Beef Talk earlier today talking about the benefits of AI in producing, a better quality calf, if you like. He's more selection in terms of replacements as well as terminal sires and so on.
Absolutely.
So really important point that. There's a number of questions coming in relation to trace elements, some asking about iodine, some about selenium, some about copper here. I suppose if we batch them all together, and I can address this, I suppose, to you, David, and maybe Frank as well. As part of your study, David, did you look at trace elements, and were there any relationship or implications of trace element if there was a deficiency in reproductive performance?
Yes, I suppose as part of that bigger project with cow fertility on-farm work that I cited earlier, the synchronization was one part of it, but equally, Paul, we had another 200 herds across the 32 counties on the island of Ireland, because again it was in collaboration with the Agri-Science and Bio-Science Institute in Northern Ireland. And we found that, I suppose, there was huge variation in terms of, both within herds and across herds in the blood concentrations of the main trace elements. And principally we looked at iodine, selenium and copper. About 15% of cows in herds were below the, I suppose, recommended levels for copper, but 80% of cows for both were below the recommended levels for both selenium and iodine. Okay. Now, that was across 6,000 cows, as I say, on 200 herds. However, when we looked at subsequent fertility in those herds, we didn't really see, any indication of poor fertility across that huge range. So while in certain herds it may well be an issue, but overall as a contributor to, I suppose, infertility in herds, it's probably at the lower end of the spectrum. Okay, so is it an issue related to thresholds that maybe they're not right, or do these deficiencies have impact elsewhere in the system? I think there's, obviously the study and most, I suppose, interventions or measurements on farm will be based on blood or systemic levels. So again, not always, particularly for copper, a really accurate indicator of the copper status. And there is, I suppose, some compensatory mechanisms there within the animal to compensate. Okay. But certainly it's often cited, as, when there's an infertility issue, that it's either potentially pathogen-based or indeed trace elements. Okay. But certainly our work for either would suggest, that while in isolated cases, and again, obviously in conjunction with the farmer's veterinary surgeon, they need to be followed up upon. But in the greater scheme of things, other issues such as nutrition in particular, would have a much, much greater impact on herd fertility. Okay, and I turn to you, Frank O'Sullivan, I suppose. David mentioned the importance of engaging again with the veterinary surgeon and your veterinary practitioner, I suppose. In your experience, trace element deficiency, is it an issue, or is it only a real serious issue when you get very low levels? Are other issues much more important?
Yeah, we tend to take the overall, if you like, helicopter picture. So in preparing a herd for good fertility, we probably look at 4 key areas. One would be the infectious disease, lepto, BVD. Make sure they're in place. Make sure you have programs in place for those. Secondly, you would have management of AI, good heat detection, good AI technique, fertile bulls. Thirdly, the genetics, and AI comes into that. And fourthly, then nutrition. Now there's the macronutrition in terms of the body condition score at the correct times, not too fat, not too thin, but also you have the micronutrition, such as the copper, iodine, selenium story. Now, sometimes we can use these, a bit like David said, as a scapegoat or a golden nugget to blame everything on or solve everything. So I would counsel against that. However, copper in particular in our area is a problem because it's molybdenum toxic. Molybdenum is tying up the copper and we end up with a secondary copper deficiency. Now that mainly manifests itself in the young calf actually, in terms of his growth and so on. Again, selenium is not the same all over the country. There's a vein of land here in Teagasc here, and you go to the seaside over to Bettystown, and it's selenium toxic in the last couple of years. So we have to be careful about supplementing minerals for the sake of it. Iodine then, similarly, just, probably a little bit deficient, needs supplementing, but, so again, there's not one size fits all. It's a little bit bespoke, but it's worth considering as part of the overall 4 pillars for good fertility.
Thank you, Frank. Thank you, David. Thank you, Orla. So we're approaching the hour mark, so I want to draw this broadcast to a close. I found it tremendously informative. I hope you at home have found it informative as well. This brings to a close our first day of the Teagasc Virtual Beef Week, sponsored by FBD Trust. Today we focused on all things to do with suckler beef systems. I want to thank a few people as I draw this to a close. I want to thank our production team here at Teagasc Grange in our studios, Declan McCardle, Marcin DeBarra and all their colleagues. I also want to thank our panel members, Professor David Kenny, Frank O'Sullivan and Dr. Orla Keane. I suppose we've had a huge amount of content throughout the day, ranging from all of the content on social media, our beef talk at 12 midday, and indeed this evening here at Live at Grange. The organisers for this day should take a lot of credit for this, Aidan Murray and David Kenny. Finally, I would invite you to join us again tomorrow. Tomorrow is our second day of the Virtual Beef Week, and we're focusing on dairy calf-to-beef systems. Our social media output will start early tomorrow morning, so please keep an eye on all your social media platforms. Join us again tomorrow at 12 midday for Beef Talk and at 7 p.m. for Live at Grange. But for tonight, good night from Grange.